Hi, Mike Gibson, Kevin Alexander, and we are here live from ACC 2025, and we're talking about a new study looking at acoramidis and its increase in serum levels of TTR. Kevin, talk to us a little bit about what you found.
Yeah, thanks for having me, Mike. So as you know, ATTR-CM is a deadly disease, causes progressive heart failure. And there was a recent phase 3 clinical trial, ATTRibute-CM, that looked at a transthyretin stabilizer to see if that could improve outcomes and led to statistically significant benefits in terms of survival and hospitalization. In this study, we delved deeper into that data, specifically looking at the change in serum TTR. That's the protein that causes amyloid. We know that these TTR levels tend to be low in patients with cardiomyopathy because the protein's being broken down, and acoramidis can stabilize the protein, thereby raising the levels. And so we looked to see if that benefit of raising TTR levels was consistent across subtypes of ATTR, wild type, as well as hereditary ATTR, which tends to be a more unstable tetramer.
Looking at the link to outcomes, Kevin, were you able to show a relationship between stabilized or increased levels of TTR and outcomes in any way?
Yes. So like the for both wild type and hereditary ATTR, acoramidis led to an increase in serum TTR at 28 days, as well as by the end of the study at month 30. And this was associated with reduction in mortality and a composite mortality and cardiovascular hospitalization.
Well, that's very interesting because when we look at surrogates, we always want to know, is it related to the hard outcomes? So here you showed the surrogate is related to death and hospitalization. You showed that a drug improves that surrogate, raises it, and you therefore showed that the drug improved the outcomes. So, is that fair to say?
Yes, that's fair to say, Mike. And I think the nice thing about this surrogate is that it's something relatively straightforward and easy for clinicians to measure and to give counseling and advice to patients as they start treatment.
Great. Well, very nice, Kevin. Great work. Thanks for joining us here today, and thanks to all of you for joining us here live from ACC 2025.